Hello, everyone, and welcome to this audio podcast as part of the radio edition. This is an audio podcast as part of a another Storm Robotics production and as part of a Storm Robotics collaborative. This is an audio podcast as part of the research as part of a research and analysis, and this audio podcast is part of as part of the radio editioning, where there will be an overview or a synopsis in around three different art books that are in production, and so the here as part of this audio podcast, be an overview in around each of the different art books in context of the different themes between the different art books. So in around looking at the art book around art care and equality. The art book has has art linked with a particular set of descriptive statistics or summary statistics and links, and where the art book also has a basis in around looks at art in around where whereas art linked to important elements of healthcare between healthcare sectors from an alchemy perspective, and to sort of raise understanding of health and disease through art and descriptive research or descriptive statistics, and where this art book has as part of the sort of summary, there is a basis in where, for example, before implementation, surveys the surveys did not employ a scoring system, since this would have made analysis and completion challenging. Online versions of surveys were also shortened, and a simple tick box methodology was applied. 19 surveys completed from healthcare professionals, and 45 were completed from healthcare service users. Respondents from healthcare service user cohort had demographics with varying ethnicity, age range, and gender representation, and respondents from professional cohort were predominantly from white backgrounds, higher education status, and primarily female, and where in around works in around this as well. It has been construed that the majority of studies focusing on, for example, multidisciplinary team clinics incompletely report clinic structure and function, and so in around this, structure would be a bit better, would be better supported, involving AHPs, prompting sort of educational clinics online or in other formats, and wherein for example focus based scenarios to help bridge gaps between literacy and literacy language are sort of articulated and encouraged, and where there can be a sense of empowerment through encouraged through knowledge, through knowledge bases. So in around the art book, book looking at electronic patient records, or EPRs, EPRs and healthcare perceptive, where this art book looks at using art linked to important elements of healthcare between healthcare sectors, and again from a sort of a scientist perspective, and to help to raise the understanding of health and disease through art, joined up healthcare and electronic patient records, or EPRs. And in around this, some part of the summary in around this, healthcare education. Before 2000, before the new millennium in 2000, there was an instinct for education to be provided to adult and pediatric healthcare service users. To adult and pediatric or young people healthcare service users, and much of the education for in around specific diseases has been prompted as part of a healthcare service delivery, and in the main would be provided by specialist nurses or physicians, thus meeting patient information and educational needs. However, owing to more information having transpired from physical to online spaces, healthcare service users are now either signposted or prompted to using the internet to meet information requirements. And so patients or healthcare service users also use the internet. Use the internet, for example, to access peer support groups through social media platforms. And whilst this can be helpful, especially where healthcare service users have opportunity to share care and share experiences or lived experiences, peer support alone again does not override the necessity for educational support. And so the this as part of the art book, as well. This art book on looking at EPRs, and looking at linking art in context of electronic patient records, or EPRs access should also mean that healthcare service users have opportunity to contribute in care with respect to record keeping, monitoring, and preparing for appointments, and allowing joint decision to be made between healthcare professionals and patients. In this regard, the EPRs system has a basis template as to what can be achieved. And whilst the polls where this art book has an overview in context of polls that have been carried out between social media platforms, and also whilst the two polls were very basic, there were some powerful comments by healthcare service users and patients throughout, which highlight that healthcare service users would find having EPRs generally helpful, enhancing care and reducing onset of and across specific diseases, and it was also intriguing in this art book. It was intriguing to learn that or it's intriguing to should be intriguing to sort of learn, but also to highlight that many of the postings, when the polls were carried out had been where most of the postings, in context of the comments linked to the different to the polls that had been carried out, were linked between were from where postings were from those who were from mostly from those who were from Canada and USA, healthcare service users, and for example, and whether, for example, have access to electronic patient records either online, either online or in hard copy. And so some of the healthcare service users had mentioned that having access to records does enhance care, but there is still a requirement or a need for healthcare professional insight and detail. And so this art book sort of depicts or highlights some basic art with sort of a set of sort of descriptive statistics, but also highlight but also where this art book gives healthcare service users and healthcare service providers opportunity to document any notes, which then can be documented into electronic patient records as well, if and when there are healthcare service users who look to get a hold of this sort of art book or any of the other art books. And where the art books can be used as sort of, again, as notepads, but also as by way of healthcare professionals and healthcare service users documenting aspects of appointments and meetings. So in around finally sort of the third the sort of third and a third or a third sort of art book, or the seventh art book in context of all the art books together. This particular art book looks at sort of joining the dot on data series, and where there's basically where this art book looks at looks at using art linked to important elements of healthcare between healthcare sectors, and from a scientist perspective, and to raise the understanding of health and disease through art, joining the dots joining up the dots through suggestions for educational modules, but also where this art book has various abstracts are linked to a particular peer-reviewed works, and also where this art book has an overview where integrating between electronic patient records and online spaces are co-developed between a sort of co-developed effort between social media platforms and looking at point of care educational POC and educational modules should be delivered between healthcare service users and healthcare professionals, allied health professionals, and these can be linked through healthcare service online support groups, for example, in integrating a healthcare pathway for those who suffer with particular diseases, and there are suggestions for educational. Again, there are in this art book. There's suggestions for educational modules throughout, and this art book highlighted in the main sort of audio podcast around this particular art book. There are two schematics. There are two main schematics in context of art, where one of the schematic looks at sort of a proposed healthcare education integration as part of a particular care pathway in context of disease, and where the care pathway is linked and should be linked to a guide and algorithm to assess healthcare service users to access in context of accessing peer support, and or allied health professionals, allied health professionals or AHPs for advice and guidance, and or in context of educational support, and where a second schematic highlights the initial basis in around an algorithm, with sort of six points of sort of assessing us healthcare service users, and where the different points have different objectives, and thus throughout this schematic or schematic 2 in this art book looks at providing has a basis in around how how in line with the different guides, or different sort of guide or different aspect of assessment. Healthcare service both healthcare service users and healthcare service providers can be involved to sort of ultimately co-develop and jointly see that healthcare service users service users are sort of gain the best care in context of healthcare in line to this algorithm in some context, but also where ultimately the this art book has an overview in again in this proposed care pathway, where different professionals can be involved, whereas retrospectively in any sort of guidelines and frameworks where any sort of care pathways have been documented, or at least sort of iterated, there's not been ever a joint linkage between healthcare service users and healthcare service users healthcare service users and healthcare service providers jointly being involved in inpatient care, and so this art book sort of highlights a preliminary overview of what an educational pathway in context of primary care, with different healthcare professionals and different healthcare service users being involved, and then ultimately where primary healthcare physicians depending on scenarios, for example, or severity, in context of the disease severity, for example, are then refer healthcare service users to the appropriate appropriate physicians or professionals in secondary care, and retrospectively in any guidelines or frameworks, frameworks, there is no that there's n- that there number one of the main things is there has not been an educational pathway per se, and where there is where there is a referral, where there is a sort of referral stage or a referral basis, is primarily where primary healthcare physicians or primary healthcare physicians are involved or have been retrospectively involved, and refer patients, refer service users, healthcare service users onto secondary care, but where this care pathway has a basis in around consultation. There's a basis in around consultation, for example, and then where there is a pathway where there's a link where there would be a sort of an advice and guidance stage through online, potentially through for example through online social media platform, or online patient healthcare service user website, for example, on through a website or a portal, and then there is a basis where a where where specialists, where for example specialist nurses can be involved, scientists can be involved, healthcare scientists can be involved, and then depending on the scenario of healthcare service users, they are then they are then referred to a physician, in context of secondary care, and then there's a pathway in context of investigation and follow up, and then where investigation in context of investigation and follow up, we're looking at sort of advice looking at advice and disease monitoring, and then there's a sort of pathway in context of follow up and review, and in context of screening, and where this looks at follow up follow up and screening, on where different healthcare professionals are involved, and then refer to those healthcare professionals in context of secondary care, and again aligned to different different scenarios, and the basis of this schematic in this art book, also highlight sort of a basis around where each where different bases of the depicted schematic, or schematic one in this art book, sort of look at the look at a the source, or where the source of initial issues occur or have occurred with healthcare service users. Then then there's the intervention aspect, which is where there would be a consultation, where there would be a consultation, and then investigation and follow up, or then or follow up and screening, and then there would be a sort of a sort of healthcare service user sort of notification or patient notification, where this is then sort of automated, or almost automated, where basically a healthcare professional or healthcare service user can based on again based on scenarios, can be involved to actually email or prompt sort of a prompt a sort of email or electronic response based on the actual intervention aspect. And then there is the advice aspect, where which is where based on advice or guidance, advice and disease monitoring, and part of sort of review and follow up on screening, there the social media platforms, or through the social media platform website, for example, or a website, is sort of propagates or prompts a response based on the scenario, and then the response then links to the advice or the response in this context then and then it then goes to the appropriate or applicable healthcare service user or healthcare professional, and then where healthcare professional or healthcare service user is then propagated to have further discussion through either online or through online or sort of instant messaging. So one of the aspects in around this schematic is that the healthcare service user or healthcare professional can and could potentially have sort of instant messaging to the healthcare service to a healthcare service user based on the scenario, and then through the scenario and through the communication it's where it's documented, and then healthcare service user or healthcare service user or healthcare healthcare service user or healthcare service provider or involved, for example, can then have the discussion to then decide whether, for example, a patient should be a healthcare service user should be referred to a healthcare professional in secondary care. So it's the care pathway generally follows from the basis of a care pathway that's been retrospectively documented in guidelines and frameworks in context of clinical practice or medical practice from primary care to secondary care. However, this care pathway factors in the educational aspect, which throughout these art books generally highlight and can be used as points of where the art books can be used as sort of notepads for healthcare service users and healthcare professionals to document aspects of healthcare that then are linked into electronic patient records or EPRs as well. So that draws this audio podcast to a close. In around a synopsis around this as part of the radio edition. It's been audio podcast as part of a Storm Robotics production, and where the audio podcast series or the books or the art books, I should say, the art books are part of Storm Robotics collaborative. Thank you for tuning in.